This is the most dangerous sign of low vitamin B. In this video, I'll share 9 warning signs that could indicate this vitamin is dangerously low in your blood. This is extremely serious. Why? Because these signs can directly impact your life. It's crucial you pay attention because 30%, that's nearly 1 in 3 people in certain groups, may have B12 deficiency, which is alarmingly high. So these tips are essential. I'll also cover where to find this vitamin, who's at risk, why it's so common, which medications cause deficiency, and how replacement therapy works. Is it only available as injections or also as pills? I'll discuss that too. And I'll explain the ideal levels and which tests you need. Did you know there are tests that can identify issues early, even before signs and symptoms appear in your body? So these 2 tests are also extremely important. Let's start then with the signs and symptoms. Well, there are 9. The first sign that may indicate low vitamin B12 in your blood is memory changes. Why memory changes? It can even cause dementia. Look, if not identified and treated, this can actually lead to dementia. But why does low B12 cause memory reduction, and in severe cases even dementia? It's one of the things we always investigate when dealing with memory decline, because one of its key functions is in the central nervous system. B12 is essential for forming myelin, the sheath that surrounds neurons. So, for proper neural connections to happen, you need B12, specifically because of this myelin. And if you don't have adequate B12 levels, what happens? It can cause what we call demyelination. This protective coating can be damaged, leading to severe consequences, including dementia. So one of the main functions of this vitamin is in the central nervous system. While we're on this topic, another major function is in the bone marrow, specifically in blood cell production. I want to highlight the red blood cells, the production of red blood cells specifically. We need this vitamin not just for red cells, but also white cells, leukocytes, and platelets. So B12 helps with production. It's essential for this process to occur, okay? Now you know 2 major functions of this vitamin. See how important it is. So neglected, yet so crucial. Number 2, the second sign is quite curious. Changes in the tongue. When this vitamin is low, it can cause alterations in the tongue. The tongue can lose its papillae, become smooth, and appear more reddish. It can also increase slightly in size, which is called macroglossia. This can lead to other consequences, such as reduced sense of taste, for example. But I want to highlight this tongue issue as point number 2. So the smoother tongue loses its papillae, can become redder, and increase in size, okay? Very important and quite fascinating. Did you know about this? Were you unaware of this sign? Your like is already appreciated. This is a new sign that's rarely discussed. There are few videos talking about it. It's worth liking and subscribing to the channel and hitting the bell so you get notified whenever I post. Let's continue with the third sign, which is also extremely important and rarely discussed, the changes in vision. If you have low B12 in your blood, it can cause visual problems, reduced visual acuity, and decreased peripheral vision. What's that? Seeing from the sides gets harder, and it also increases your risk of AMD or age-related macular degeneration. Did you know that this vitamin can also affect your vision and eyes, your ability to see? Look how important this is. And when do these signs occur? See what I'm talking about? When B12 is low. But since I mentioned I'd comment on this, when do we consider B12 levels to be low? We can identify this through a blood test that measures the vitamin level in your blood. The ideal values to avoid symptoms typically range from 300 to 800. There's a gray zone from 250 to 300 that some labs consider normal, but many people already show signs of B12 deficiency in this range, okay? So generally, you want levels above 300. There are 2 tests that can indicate low B12 before the standard blood test shows a drop, when patients may already have symptoms at those levels I mentioned. What are these tests that serve as early markers of deficiency? There are 2, homocysteine and methylmalonic acid. These can increase before the actual deficiency shows up in your test results. So people with these signs and symptoms who have normal levels, especially at the lower limit, these tests are extremely important. And sign number 4, which is the change in balance and coordination. Often this can lead to falls. The person can no longer perform activities the same way as before. There are changes in gait, walking, and running because of reduced balance. Because vitamin B12 is also very important for our proprioception, right? For that sense of balance and coordination, it becomes more difficult. The same activity you used to do is now harder to perform. So it may be a sign that this vitamin is low. Hence, frequent falls. You experience dizziness. It can cause this too, right? Affecting proprioception, it can cause dizziness. One of the things that's often overlooked. The person feels dizzy, thinks it's vertigo, gets other diagnoses when actually they have a vitamin deficiency. We've already seen that this is extremely common. And sign number 5, paleness, shortness of breath, weak nails. These are all signs and symptoms of anemia. But why anemia? You've seen that we need B12 for red blood cell production. If you have this deficiency, your body may show these anemia signs and symptoms. It can even cause heart problems, such as heart failure due to anemia. So it's very important to evaluate this. Have you seen these values in a blood count test? There are several acronyms there. There are 2 I want to highlight. First is hemoglobin, which we use to determine if someone has anemia or not. If this value, often labeled as HB or hemoglobin, is low, we need to check another number, the MCV or mean corpuscular volume, which provides an important clue. Why? Generally, when B12 is low in the blood, you can develop anemia with enlarged red blood cells. So what's the normal range for red blood cell size or volume? Between 70 and 100. Often with this deficiency, we see macrocytosis, red cells larger than 100, sometimes even larger than 110. When we see this sign here, this increase in this number, we must think about B12 deficiency. There's another common deficiency that can also cause this, folic acid deficiency, which can lead to enlarged red blood cells and reduced hemoglobin levels. Now, the most common type of anemia worth mentioning is iron deficiency, which causes the opposite, low hemoglobin with tiny cells. We call this microcytosis. So it's always important to look at those small numbers. They provide interesting clues and can be key to making a diagnosis. Remember that when we find low B12, it's crucial to evaluate other causes too, as patients often start supplements but symptoms worsen. Has that happened to you? It's very common. I see many such cases because these deficiencies often occur together. So when we evaluate B12, we also need to check folic acid, B6, and iron levels with specific tests for this, okay? Let's continue with the signs and symptoms. Number 6 is reduced physical fitness. What do I mean by reduced physical fitness? For example, you could climb 4 flights of stairs before, now you climb 1 and you're tired. Shortness of breath is also very common. Patients come in saying, my breath is short, I can't do the same activities anymore. In more serious cases, even daily activities like housework become difficult. But I like using the stairs example because it's easier to recognize. It's more objective. You used to climb 2 flights, now 1 leaves you tired. That's a big warning sign. Why is this happening? And one evaluation to consider is precisely your B12 levels. Sign number 7, and this one is the most concerning, not for its severity, but for women. It's hair loss. I'm not saying this jokingly at all. This truly worries women a lot. If you're a woman, you know this. Sometimes I see patients with vision problems, anemia, or memory issues, but what actually brings them to a doctor is hair loss. They consider it the most serious symptom. I sometimes joke about this, but it's absolutely true. Sometimes the key to diagnosis is in the hair. We do a complete vitamin evaluation, which endocrinologists also handle. Many seek me for this because hormonal changes and thyroid issues can cause hair loss. Many know this, and sometimes I diagnose low B. So with hair loss, we must also check the levels of this vitamin. And sign number 8 is very interesting. Remember that function of protecting neurons? If you have low B12, you may experience numbness, sensitivity changes, and many report feeling like ants crawling on their legs. And typically, this sign of reduced sensitivity tends to appear more at night. It's not because it worsens at night, but because that's when people pause to pay more attention to their body. For example, when you lie down and pull up the sheets, many report burning sensations indicating reduced sensitivity. Tingling, burning, there are various signs this condition can cause, including neuropathy. Many people only associate these symptoms with diabetes or high blood sugar levels. Many only test for diabetes when the actual cause is something else. So always evaluate this vitamin level if there are changes in sensitivity. Sign number 9. Since B12 affects the central nervous system, it can cause mood changes like depression. Often, someone on medication who is stable suddenly begins to worsen, right? This could indicate an underlying deficiency. So when diagnosing mood disorders, this vitamin should be checked. Remember that there are organic causes of mood changes in the body, and one of these causes is precisely low B12 levels. I mentioned at the beginning of the video that I would talk about medications. There are medications that can increase the risk of this vitamin deficiency, like metformin, the most widely used diabetes drug in the world. If you take metformin, you should get regular blood tests for this vitamin. Wait, but why? Because it increases the risk. Other medications that affect stomach acidity, like omeprazole, pantoprazole, esomeprazole, the prazoles, also increase deficiency risk. And what's the catch here? Many people start taking metformin or omeprazole, for example, and after 3 months they get tested, and then that test shows no deficiency. But what's the catch here? We have vitamin B12 reserves in our bodies, so this deficiency often appears years later, not days or weeks, years. There are cases where deficiency occurs 3 years after starting medications because we have these reserves. So it's a big mistake. Sometimes people do 1 or 2 tests and think, oh, everything's fine, I won't have a deficiency. That's the misconception. What other factors increase the risk of deficiency? People over 65 are also at risk because their stomachs may lose the ability to produce acid. We need this acid. Parietal cells produce this acid for intestinal absorption. So elderly people should also get this test done regularly. Those who've had intestinal or stomach surgery, like bariatric surgery, know the intestine is crucial for absorption. Often you've removed a part that produced acid or was involved in absorption, so regular testing is mandatory. For those who don't eat certain foods, especially vegans who avoid animal products, what are the sources of B? Mainly animal-based foods like eggs, liver, seafood, chicken, and red meat. I want to highlight red meat specifically. Other foods like liver are also rich in this vitamin. So it's very important to consume these foods or have your blood tested to check your levels. Many people need supplements because they're not getting this vitamin from food sources. Dairy products also contain some B. Anyone with an autoimmune disease is also at risk for this deficiency, such as type 1 diabetes or Hashimoto's thyroiditis, the most common form of hypothyroidism, which is autoimmune hypothyroidism, or Graves' disease, the most common form of hyperthyroidism, lupus, any autoimmune disease. You'll have a higher chance of low B12. Why? You might have a condition called pernicious anemia or atrophic gastritis, which is a change in the cells that produce acid. This is an autoimmune disease, and you need to be very aware of low B12 levels. Now, for replacement therapy, the treatment is preferably taken orally or sublingually. However, depending on the cause, your doctor may prescribe injectable medications. For example, we already know if a patient has an autoimmune disease affecting absorption or had stomach surgery removing essential parts for absorption, oral medication won't work. In these cases, we can use intramuscular injections instead. Then about dosage, people always ask, what's the dose? That requires medical evaluation as it depends on various factors like lab values, the patient's condition, age, and other health issues. So multiple factors determine the ideal dose for each individual. From 0 to 10, how would you rate this video? If you give it a 10, I'll make more videos like this. Comment below if you've had this test done. I had mine last month and my vitamin levels were good. What about you? Write your city in the comments. I'm from Porto Alegre. Now I'll leave you with a video recommendation. It's a video where I discuss the best foods for diabetics. Did you know diabetics need to be very careful with their diet? There are foods that are beneficial and others that are harmful.